Doing good. There we go. We got all these alerts up. Nothing better than making sure that everything is up and running and working correctly. And my sister does that so well. Well, good morning, everyone. We are on a little bit later because we got a marvelous guest on today, but I hope we're doing good on this Trending Thursday. This is Carol Sue, AKA Naughty Boss, live with
TwoSistas. Hey, good morning, everyone. This is Janice, aka Wellness Diva 5.0, here with the doctor in the house. We are so excited to welcome Dr. Leslie Golden to the TwoSistas podcast family. Let me just tell you a little bit about Dr. Golden. She is an obesity medicine specialist and founder at Weight in Gold Wellness. She's also an expert in behavior change, finding weight health. And here's what's very interesting about Dr. Golden: recovering from emotional eating and personally living with obesity. Welcome to the TwoSistas podcast family, Dr. Golden.
Thank you so much. I'm happy to be here.
So, Dr. Golden, oh my gosh, I have so many questions. And I think from a health coach standpoint, of course, going through my own journey, when you work with not only a health coach, but especially with you as a doctor, knowing that your patients know that you have also struggled with what they are going through, I think there's more of a genuine connection.
I couldn't agree more. It really creates a safe space. I mean, I think in so many ways, because I've experienced it myself. I remember years ago being an undergrad and getting my bachelor's degree and going through, and I had what I thought was a very great relationship with my provider at that point. And when I was changing providers because of a move, I requested my records. And I will never forget the feeling as I looked through my records and seeing year after year statements about continues to gain weight every year, seems to have no insight, obesity. And she never said anything to me. It was never a discussion. It was, there was no diagnosis. There was none of that. So I try to put myself, and I always remember that interaction, or the lack of interaction really, and the way that felt afterwards of feeling judged, feeling shamed on paper. And the person who's supposed to have this relationship with me to have the hard conversations and look out for my best interests, I felt failed me in that and kind of shifted the blame over to me. And I always try to remember that and remember how difficult it is for us as patients to not only, live with obesity in our society, but also go and see a provider and bring up that conversation, because so many times it's met with just walk more, just don't eat as much. It's this simple, or things like that. And so being able to have that experience, that lived experience, and share that with patients to create that welcoming, shame-free, judge-free environment, that I'm not blaming them. This isn't their fault. And I need them to be able to share everything they can so I can help them. And only then can we really accomplish something.
I look at it really from a different perspective, because I really don't think it was shaming on paper in the sense that you bring up. Those are your feelings, and I get that. But it's really more of because obviously you didn't know about it. She didn't say it to you, so you didn't feel that feeling as it was occurring because you didn't have the conversation, right? To me, it's more of a declaration of this, whatever this doctor was, lack of inability to fulfill their oath on talking all areas of health and confident in such a way, because some people can have that hard conversation. People know when they're overweight. They know when they got to do better. The conversation has to come up in such a way that it's like, we're on the same page, right? We know you need this help. So let's figure out what are your strengths? Where do you feel good about? Where do you feel uncomfortable about? Then there's no shaming going on. So I don't necessarily think it's really, to me, it's more of a depiction of this doctor's lack of inability. And if anyone, I guess, I think we use that word too frequently in some regards, to me would be a lack of, fulfilling their obligation and their oath. So that's more of a reflection of that, not you.
Yeah, I can see that. Yeah. And I think I just go to that shame because it's that feeling, that's the way I that's the best way I can describe that feeling when you read it, that's kind of what washes over you. And I think that is one of the feelings that keeps a lot of patients from being able to comfortably come forward with having the conversation, because now we are in a different environment than we used to be, where we are considering this to be a disease. We are like looking at the tools that we have to offer people. There's more training out there. I mean, it's all over the media that there are more options than there ever were before, and people are seeking it. But I definitely still see people that are hesitant to ask for help, and almost scared even to come in. One of the challenges I'm always working with is how to make people feel more comfortable to come to see me, because it's an interesting thing that I experienced, that with those first visits, when patients come in, there's some standoffish. They're a little standoffish and not comfortable necessarily sharing at first. And then by the end of the appointment, it's like 80% of the time they say, "Oh I don't know why I waited so long to come in. I wish I would have known that it would be this kind of experience. I've always been treated negatively when I've interacted with doctors about my weight." And so I definitely see that shame that people feel that keeps them from being able to move forward, possibly.
And I think that's something really important to point out, because, when a lot of times when they have that realization, like, I don't think that they maybe understand the depth of, they should like celebrate the fact that they're in that spot to be with you, and that somebody is not just hearing them, but is listening, and they feel validated. From my own excuse me, my own personal journey, I remember distinctly having this conversation with my physician, and thank God that he took that time to talk to me. And he said, you've been steadily gaining weight. It's not like you gained 2 or 3 pounds. Like, I was gaining a lot of weight, but I took that to heart, that he took the time to listen to my concerns and validated how I felt. And I think that really was the starting point of my journey. And I don't know if I would have done that if he hadn't. I think I froze up. I'm just going to double check.
Yeah, you did for a little bit. And what I like about that is, I think part of the problem, and I'm not saying doctors across the board, most do not have a nutritional background. They take a course in order to get their license, part of their training, but they're not nutritionists, number one. Number two, there are many doctors that have the ability to be frank, but do it in such a way that's kind and putting into perspective, making that person feel comfortable with, but it is a hard talk. And I think it's not a talk that everyone doesn't want to hear, but to me, it goes in line with, there's a lot of other subject matters that, we talk about depression, mental illness. There's so many things that people feel afraid to have that chat with. So I think as a whole, the medical industry has to do a better job of really understanding the mental piece that comes with somebody coming to them. They're not, most people, they go there for health and wellness. They get their blood work in, average person in and out, they're there once a year. But there are other patients that do have pieces of their life's journey that needs medical attention. And that also includes kind of a heart-to-heart talk with them, but a heart-to-heart talk doesn't have to be mean or vicious or shameful. It says, look, let's have that conversation. And start it off with, I know it's uncomfortable for you. And I feel for what you're feeling. I get it. But in order for me to help you and really gain perspective on where you want to go, we have to have this conversation. Is that all right that we chat about it? To me, there's ways of making sure that you don't make someone feel bad. I am not struggling with weight, but I can tell you, I can use that same scenario in many other medical pieces. So I don't think it's necessarily specifically on weight, which of course, that's what we're talking about. But I think as a whole, the medical industry has got to do better. Physicians have to get over the stigma. And I always refer it back to their, do they have a good bedside manner or do they don't? Are they arrogant or are they kind? And if a patient feels like, I'm not really comfortable talking about it because maybe the conversation's not even open up, do I have the strength and courage to say, hey, I need help? Or am I going to have an intuitive doctor that knows this is life or death? Because we know with obesity, it impacts your heart, your diabetes, your joints, muscles, everything. If, for lack of better terms, if the physician doesn't have the balls enough to fulfill his obligation with that patient and have the hard conversation, but do it with dignity and kindness, shop around and get somebody better.
It's true. And I think those are excellent points because you're right. There are so many other conditions like depression, anxiety, fatigue, that can be difficult to bring forward. And I can think of scenarios where asking for that kind of help may not feel welcomed, in this
Right.
environment now where patients are told, well, you're here for your wellness visit and that's a problem. That'll have to be another appointment, or we don't have time to address that today. You need to schedule another appointment. I mean, it's tough that this industry, like healthcare, has become this industry in a way with these time limits, because it creates this situation where a patient's not able to really share what all may be going on. And even as something as simple as, hey, my blood pressure is high, I think not all, but I think a lot of providers have lost that ability, or taking the time, and maybe have lost the mission and sense of purpose to take a step back, and rather than being like, well, here's your blood pressure medicine, taking a step back and like, well, what's going on in your life?
Right.
Because chronic fatigue, you're more fatigued than you have been, and you're depressed, or you feel depressed, rather than just immediately getting a bunch of labs and starting a medicine. Like, what's going on? Is there a job change? Are there struggles in your family? What's happening in your life? And do we need to investigate the more difficult contributors? Because for a physician, those are much harder things for us to fix. It's just so much easier. It's just so much easier to hand you a prescription. But we're not really having the impact, and we're not really helping that patient make that complete whole person change that is necessary to really understand what's going on with their body and themselves.
And I realize too, and I think Jan and I could, have chatted about this before. We obviously, most people realize, the restraints between insurance, really kind of a meat market of get them in, get them out, write the script, get them out. What pharmacy, what pharmaceutical company am I dealing with? What drug am I trying to push? Those are all pieces. And I think back in the day, when I say back in the day, I'm talking about 50s and 60s, where, most patients went in with blinders on, and the physician and the nurse were the be end all of everything medical. And you never challenged, you never questioned. You took their word for verbatim. They wrote that script. You took it verbatim. You didn't say, hey, can I try to fight this high blood pressure with changing my diet? Can I talk to a nutritionist? And I think that's what has really evolved, especially over the last 3 years, where obviously we're at a different time with dealing with the virus, and people said, you know what, I got to do my own due diligence. And I think, I always put it into perspective. If you go to a grocery store and you don't like the choice of produce, and then discovering you don't like the meat department or whatever, or they're not carrying your favorite brands, or you go to this gym, or you go to, this department store and they're not carrying your line of clothing, what do? You normally say, well, I'm going to shop somewhere else. And I think what's happening is there's a flip in the switch with people's mindsets to say, no, what? Ultimately, I'm the one in charge of this. And if I'm not going to ask the questions, or I'm not going to have an interaction with a physician that's going to respect my time, you make me wait, while you're behind in your schedule, but you're not allowing me the time that now it's my appointment and I got questions. And I think people are starting to say, you know what, I'm going to start shopping around. And so they should. And I think that's what's really changing a lot within the industry, because we've had other doctors on, and that's usually the common denominator. People are saying, look, I want to partner with you with my health and wellness. I don't want you dictating to me in such a way that I'm not comfortable to share like what I think is going on. And I'm not the professional, so I could be far off, but don't dismiss me as if what I have to say is not important, or don't make me feel bad because I'm coming to you because I know I got this problem, but yet I don't know what to do.
Right. And I think that's so important. And it's definitely a culture change within medicine, right? Because it used to be this paternalistic style of I'm the doctor, I know best, you do what I say. And thankfully, I came through in a time where it was more shared decision making, and which, I'd like to think that, training or not, I still would have done it that way just because of who I am as a person and my communication style. But to me, that's my most favorite part of that relationship. Is I remind patients all the time, hey, you're the expert in you. You are the expert in you, in yourself, in your journey. Nothing's going to work unless I have your buy-in. And I may be, the expert in my field of medicine, but only together, when we combine that, are we going to have the best outcomes and be successful. Because I can give someone a script or recommend something all day long, but they're the one who has to go and follow through with that day in and day out. Right. 15 minutes, 30 minutes twice a year, I really don't think I have a place to really command that I know exactly what you need to be doing in your life. I need that input from them, and then I can guide as much as possible with what I know.
Are you finding where anyone in your field specifically, and they could be from all different medical specialties, that have these kind of roundtable discussions amongst themselves to talk about exactly what we're talking about, and really making that experience for the patient more of a partnership? And
I
where you're fine, even your own personal experience really depict, the need for that.
mhm.
Do they have that? Do you think that that's kind of it's a slow change, but it is happening?
I think there definitely the conversation is being had within subgroups, and so I mean there's that direct primary care movement that has been going on, and I think in many ways that has been inspired by physicians coming out and wanting to have that true relationship, that protected time, take care of a patient the way that they feel is best and not have to follow these 15-minute appointments.
Right.
There's definitely like continuing medical education that goes on talking about physician burnout. And one of the big explanations we think could be there behind physician burnout is because of the strains on the physician-patient relationship. So many physicians end up not feeling that value, not feeling that sense of purpose because it's being robbed of them. Like, sure, you're checking off the boxes and doing your job, but there's a big difference between going home at night and feeling like I really did what was best for people. And yes, it may be exhausting, and yes, the electronic health record is terrible, but I really had impact today, versus going home and not feeling that and just feeling like all your efforts are for nothing. And I think that's a huge contributor, and the conversations are being had, probably not at the frequency or volume that they need to be.
And I think that's an important, that makes an impact on how people feel about that physician-patient relationship. I mean, obviously, for instance, your patients know that they can have a logical and have that connection to share, it may not be, I always reference potato chips. It may not be that, that they are picking out on potato chips. There's an underlying issue that goes with that. Like everything connects. And in fact, excuse me, we had a recent guest on that had a situation with her physician, and totally different subject. But what I learned from that conversation with her, even more so, it's really important to, no matter maybe how difficult it is to have that conversation and sit down with their physician, they have to have that conversation, and it's okay to be, I was just in the doctor's office the other day and I was like, oh, I got to ask her these questions, but she's very open and, hey, how you doing? It's important to have that impact on vice versa with one
And it goes
another.
with all different aspects. I mean, I have a needle phobia. So I had to get blood work yesterday. And I'm like, can I check out the gauge of your needle? And she, kind of looked at me. I said, no, I'm serious. I want a PD needle. So she goes, are you kidding me? I go, oh no, I'm not, I'm dead serious. She was cracking up. So, people need to speak up. And it is difficult because, like you said, you want to make them feel comfortable, that they know you are in an area where you should feel comfortable, and I'm going to make sure that you do feel comfortable to talk about those tough subjects. I mean, weight journeys and obesity usually stem from a whole mental piece that maybe even that physician is not even in tune to kind of connect the dots. Okay, let's get you on a diet, let's get you on a fitness plan. Okay, so, and how many times, I'm sure we've seen this over and over again, where people have success and losing the weight, they're doing good, and all of a sudden 6 months later they're ballooned up again because they didn't get to the root of the problem of why they eat, or why they're stressed eating, or why they're eating yo-yos or ho-hos in the middle of the night. And though that's an intricate part with weight loss is you've got to get to the bottom of why you are doing, are there other, like you said, are there other areas of your life that are, interacting with why you are not stopping to eat?
Sure.
And,
And
so the whole gamut of those things. And I think too, some doctors just, and I applaud you for, making that space where they're going to feel comfortable, because a lot of doctors, they don't even get it because that's
Right.
not their field per se.
Right. And I definitely see them like in my community. There are some of the docs, and I appreciate their interest. Some of the primary care docs are like, hey, we're prescribing some of these meds now. But we're not really seeing them have some of the results that you're seeing. What do we need to do? And what are you talking to them about? And I'm always, my response is always like, well, how are they eating? Why are they eating? How do they know what a physical hunger cue is versus an emotional hunger cue? Are they watching for enough? And when those thoughts of why enough isn't enough come forward, how are you talking to them about how to deal with that? And there's always these, of course, blank stares of, is that complicated? And it is, right? Because if it was as simple as eat this, exercise in this way, solved, we wouldn't be in the situation that we're in, right? But there's so much mindset work, there's so much thought work. We've developed these coping skills over time, and they work. They've created consequences that we don't like and are threatening our health. But in that moment, when we've developed emotional eating, it's worked for us. At least we feel like it does, for a long time. And a lot of patients and all of us have to learn and be informed that we're not a lost cause. We're not emotional eaters. We are people that have learned to eat emotionally, right? And anything that can be learned can be unlearned. And I really like to help patients understand that nothing's gone wrong. There's nothing wrong with them. They're not a lost cause because they've developed this, because some people feel like they are, right? And that this is actually how their brain and body was designed to work. Food does give a great response that relieves whatever feelings we're trying to avoid. And of course, it's going to create that loop, and it's become a habit. And yes, you're not aware of it, but we can learn to become aware of it. And when we take the time to help people understand what's happening in their brain and in their body, and start to give them the tools to reduce the frequency of that loop and strengthen a new habit, we can really start to create a new pattern that will help them recover years later, and they're not having to walk around with Dr. Golden's laminated food list as their go-to tool for the rest of their lives, because it is so much more about repairing the relationship with food, repairing the relationship with ourselves, not being afraid of our feelings, and developing these coping skills, and learning that self-care has many different faces. It's not always just having a bubble bath with a glass of wine, like so many people like to think about it. Sometimes self-care is saying, hey, I know you're tired, but a walk is really what's best for you right now, and you're going to feel great. Sometimes, and a lot of times, that is self-care, and helping people recover from their trauma, their diet trauma that they've experienced. I mean, when we've created these scenarios where we don't feed our body when it's hungry, of course, we're going to have all kinds of feelings of anxiety and stress every time we get hungry, because our body doesn't trust us to feed it anymore. So helping people understand that all of these things they feel related to food are normal processes that the body has developed over time, but we can learn new ones, and we can unlearn these previous cycles.
Right. And it's all about habit, getting into those good habits and actually writing them down. Because I love the fact of what you had said, these things can be unlearned. We are capable of developing, so you develop some bad habits for many years. Well, guess what? We're going to change that around and we're going to develop some new habits. You didn't learn the bad habits overnight. Well, same applies to the good habits. You're not going to learn them overnight. It's a matter of
Yeah.
repetition and forming that good habit.
Yeah.
Oh, so many good things.
And the expectations are tough. I mean, so many people have such unrealistic expectations on how quickly we should be able to change these habits. I always like to use, when it's 2023, we write 2022 over and over and over, and at no point do we say, oh, I guess I'm never going to learn this. I'm just going to stick to 2022. But when it comes to weight loss, how many times do so many of us say, oh, I'm going to start walking the dog 10 minutes every day, and day 3 we don't do it, and it's like, I guess I'm just not going to be able to do this, so I'm not going to walk anymore. We just don't give ourselves that grace, that patience to allow ourselves to learn something new. It seems like when it comes to nutrition, when it comes to physical activity, we don't give ourselves that space free of judgment to allow ourselves to learn something new. It's immediate, like, I guess I'll never get this. I'm never going to lose the weight. Why even try? I feel so many of us go through that because there's this just this all or none idea, this diet culture idea that unless I do it perfectly, it's not going to work. And if I can't do
think
it
that's part of
perfectly,
it, but I think the other piece is we're just too impatient. We're in a society, and that's faulty of marketing. Lose 10 pounds in 3 days. Get in that size 6 in 2 months, and they're
Right.
all unrealistic expectations. And the fact remains, regarding any kind of, whether it's weight loss and or weight gain, because there are many people out there that need to also gain weight, which I know we'd like to
For
take
sure.
a flip flop and probably beat them on the head a few times, but that's just how it is. Everyone's metabolism, things are different. We're not patient enough to understand that and really understanding that, our mindset has been robbed and changed because of marketing. We want everything instant gratification, instant results. And the fact remains that the longer it takes for a new habit and or journey to reset and become successful in, the better that the success is, that it's going to stay that way. If it's instant and or, all of a sudden you see somebody, oh my God, I don't know how they did. How did they drop that 10 pounds in a week? Well, I wouldn't want to go there of how they did it because it probably wasn't really healthy.
Yeah.
But the fact remains that your body does take time, our hormones, all that things have to reset. And, you got to give yourself 21 days to see any kind of slight change. And I think society's too impatient because we're too quick for quick responses, quick reaction, quick results in a supersized world.
Right.
And we
So
don't,
true.
yeah, and we don't learn anything from that. And I think the only thing I know, again, I'm referring to my own journey, the only thing that I learned was the diet trauma aspect of it. Because when I had that conversation with my physician, I knew that I had to really do things very differently. And I remember sitting down and writing things out. And what I found was, and I had to be, and I said to myself, if I'm going to do this, I need to be honest with myself. I'm going to give myself grace and dignity, but I have to be honest with myself. And what I found was that I was justifying my behavior. In other words, go back to the bag of chips. Well, every time I was sad and happy, I was going to the bag of chips. Okay, well, why was I doing that? Because it was such a normal behavior. Even though I knew it was bad, I knew it wasn't good for me, I was still doing it because it was normal behavior. And let me tell you, I'm going to tell you, it was very eye-opening for me. And in that moment, I'm like, I am being totally honest, like with myself, like I felt a weight lifted off of me.
Mm.
That's awesome. So tell us, Dr. Golden, how do your clients, patients get a hold of you? What kind of, what makes you different from somebody else? I could hear, rightfully so, the passion come out in the tone of, the care that you obviously give to your patients. You could feel it.
Oh, well, thank you. Yeah, so in my community, so I'm in Wisconsin. So I can take care of patients virtually throughout the state. And locally, a lot of the primary care providers will refer to me, a lot of the cardiologists, surgeons, especially a lot of people dealing with chronic pain and arthritis issues. A lot of their doctors will have them come and see me. So I get a lot of referrals, but also just current patients bringing in their families. That's one of my favorite things. I have several groups where it's multiple generations that I'm taking care of, because there's benefits to improving our weight health at any age. I've had several patients that are later in life that maybe they don't need oxygen anymore because of the weight that we've been able to reduce for them, and their quality of life is just so different, which is incredible. And I try to speak as much as possible, on Facebook Lives and podcasts, and not just to help patients find me, but to help patients find someone, and to know
Right.
that there are providers out there that will meet you where you are and help you. And as far as what makes me different, I definitely take a comprehensive approach. I take the time to find out the entire weight history, like through your whole life. Let's talk about, how did you face food scarcity? What types of stressors are we dealing with? What types of traumas did we possibly have in childhood to where food has become a coping concern for us that we have to address? And then how is their weight impacting their health? So doing a full evaluation of all the other conditions. They say about 220 other medical conditions can be essentially influenced by weight. So I try to see
Crazy.
how it's impacted. And then we work together and create a nutrition plan, and usually it doesn't look like here's your list. It can be as simple as, can we do 1 soda today rather than 5, or something, or it can be, can we eat out 3 times this week rather than every day? It just depends on the patient, and making these small changes that don't feel like deprivation, that don't feel like my life has been turned upside down. And we try to work on a reasonable physical activity change. And we always start with some type of behavioral approach, whether it's being more aware, whether it's self-care, whether it's being more present. And we'll talk through, are medicines an option for them? Is it something they need? And make sure they understand what comes with the medicines, because I think in this current world, especially with these medicines all over social media, there's a big misunderstanding that these are like a temporary fix or a take it and move on type thing. When we're treating obesity with medication, just like high blood pressure, just like diabetes, if we're giving you a medicine that's controlling the hormones and the brain signaling, we don't expect that is cured by reaching some magical weight. If kind of like if your thyroid's not functioning and I give you a thyroid supplement, when your TSH or when your thyroid is balanced in the body, I don't just say, okay, now I'm going to take it back because now your thyroid should manage on its own. It doesn't. So these are supposed to be chronic medicines, And I always like to make sure that patients understand that before we start them with that full consent, that they know that these are long-term medications, and potentially coming off of them later can cause weight regain and potentially more complications than what they started with.
Right.
Right. So, Dr. Golden, where can our listeners and viewers connect with you further?
So I have a website, weightandgoldwellness.com, as well as a Facebook page and Instagram page, Weight and Gold Wellness.
Perfect. And
That's
of
awesome.
course, we will make sure that all of that information is in the show notes. Diet trauma, don't go it alone. This has been such an amazing podcast today, Dr. Golden. We are so excited that we have this opportunity to share with you and share with our viewers and listeners. Thank you so much for joining the TwoSistas Trending Thursday podcast today.
Thank you.
Been awesome. Great info, great insight. And I think, what would be the one message that you can tell our listeners and viewers that would maybe spark enough courage to say, hey, let's chat? What would be, or let me word that differently. What would be the one thing that you would suggest for them so they know that, whatever doctor they choose, if they're not reaching out to you, would be the one question they should be asking their physician?
I think there's a lot of value in going to a physician currently and just saying, I'm aware that weight is considered a disease now. I'd like to know what options there are for me. And I would just say, if your physician says, I don't know anything about that, or I don't believe in that, please say, well, can I have a referral to someone who does?
There you go.
Because that's the big message, that we're trying to pass to doctors: treat or refer. And so for patients, if your doctor is not comfortable or just doesn't know, there are plenty that do, and they should be able to give you a referral to someone who can help.
Awesome sauce. Well, you heard it first there, right from the doctor's mouth. You've got to be postured in your own health and wellness journey and ask the tough question. No, is it easy? No, it kind of sucks. Let's all be real. However, if you're looking for living a healthier version and feeling the best that you really can be, you got to have that conversation with the person in the reflection in the mirror, which is you. And we know that's tough. We know that, but the bottom line is you got to do it, and you do it on your terms by asking that first question. With that, this is Carol Sue, aka Naughty Boss, live with TwoSistas.
Hey everyone, this is Janice, aka Wellness Diva 5.0, and no, there are no potato chips in my house. We shall see you tomorrow for Fantabulous Friday. We all hope you have an amazing day. You be the trendsetter. Bye for now.
Take care. Bye-bye, everyone.
Bye.